In our morning rounds, October is Breast Cancer Awareness Month, and this morning we're focusing on male breast cancer. The disease in men accounts for about 1% of all breast cancer cases. This year, it's estimated close to 2,700 men in the U.S. will be diagnosed with breast cancer. Our Dr. Tara Narula is here. Tara, how much of a problem is this?
Well, Anthony, statistically speaking, it's not that common. About 500 men will die this year from breast cancer, compared to more than 41,000 women. But the mortality rate in men is higher. And in the case of Tammy Porter, she says the lack of awareness around the disease caused a delay in her late husband's diagnosis.
It never even occurred to me that he would any type of cancer, certainly not breast cancer.
4 years ago, Tammy Porter's husband, Mike, first started noticing symptoms of breast cancer.
He literally had a pea-sized lump under his areola on his left side, and he pointed it out to me one day, just kind of matter-of-factly, and I said, oh, that's interesting. And, you know, there was no discussion of it ever at all until probably 3 to 4 months later, and he said, I think this is getting bigger. And at that time, it was much closer to a dime size, and his nipple was inverting, and I could tell that there was some growth there.
After a visit to their physician, Mike was quickly scheduled for a mammogram. What did Mike think about the mammogram discussion?
I think he was embarrassed a little. It was really hard for him to mention the words breast cancer. He would say, I have cancer, but it was hard for him to actually discuss the breast cancer part. You know, it was very ostracizing walking into a clinic that's full of pink and, you know, the mammogram room that literally says women only.
He underwent a radical mastectomy and radiation, but the cancer metastasized to his lungs, spine, and brain. 2.5 years after diagnosis, Mike passed away.
If we had known 3 or 4 months prior, you know, it may have been a stage 1 diagnosis. It was an aggressive cancer, and so it might have been very different had we known.
So you think if this had been on either of your radar screens, then when he first felt that lump,
for sure,
you potentially could have gotten treated earlier, and the course would have been different.
Absolutely. I can only imagine that, you know, having that earlier intervention would have definitely changed the course for him. Particularly
in men, that early detection is critical.
In general, men have lower survival rates than women do after they get diagnosed with breast cancer.
1/3 of Dr. Sharon Giordano's patients are men, and she says men often get diagnosed with more advanced breast cancer in part because of lack of education.
Some of the risk factors in men include genetic factors such as BRCA mutations, exposure to radiation therapy in the past, a family history of breast cancer. So if they have a first-degree relative who's had breast cancer, they have more than double the risk of having breast cancer themselves.
It was knowing his family history that helped former NFL player Paul Dombrowski.
My mom was a breast cancer survivor for about 25 years, so as soon as I felt the lump, I just knew right away that it was breast cancer.
In 2013, he was diagnosed with breast cancer.
I immediately thought, how do I battle this? What's the next step? It's almost like a football player where you're injured. How do I get back on the football field?
Dombrowski is now in remission, and his mission is to raise awareness.
A lot of guys I played with, they say, I didn't know men could get breast cancer. I say, bro, you got breasts. You know, call them what you want. We used to call them pecs, your chest. It's anatomy. And the rarity thing, I think we should kind of drop that term because it's not rare to that man and that man's family.
As for Tammy, she hopes sharing her loss will help save lives.
He vocalized a number of times that he hoped that his life wasn't in vain, and that it would mean something, and that we would be able to change someone else's life by telling his story.
The FDA recently put out guidance recommending men be included in breast cancer clinical trials. It's typically only women participating in these trials. And for men, the symptoms are usually a lump behind the nipple or some bleeding.
Wow. It's so interesting that early detection in men is especially critical.
Yes, because most men pick it up at a later stage. And at that point, it's metastasized and the survival rate is much lower. But if it's picked up early, the survival rate's equivalent to that of women.
I love Dombrowski's basically infomercial for this. It's like, bro, you got breasts.
You got breasts.
You know?
Yeah.
It can happen to you too.
Exactly.
But I'm struck by how giving she was to share the story, though.
Yes.
Because it will certainly help people who are watching today who never thought about it, men, will now look at it very differently.
They
And I
had a
think
very-
that's important.
Because, bro,
Yeah.
you got breasts.
You got breasts.
It's at us
Yes,
too.
you both do.
Tara,
You both do.
We all got
I've been
breasts.
wondering what
Gayle King to Human Resources. Gayle King to Human Resources. That's very important. Thank you, Tara.
All right, Tara, thank you very much.